Hi and good morning, everyone. We're just going to start in 1 minute, so if you're on the line, thank you so much for being here, and we'll be right with you. All right, good afternoon. Welcome to the California Certified Organic Farmers Connecting Organic with Hospitals webinar. We're very excited to have you here today. We have 3 great presenters who will share with you their experiences helping producers get organic and sustainably grown produce into hospital settings. Before we begin, I wanted to give a warm thank you to our sponsor, Old Brook Organics. Old Brook Organics is a CCOF certified member located in Brookhaven, Mississippi. They provide mixed vegetables, melons, white mango turmeric, and blue bubba ginger to Jackson, Mississippi and the surrounding areas. The addition of a high tunnel in July of 2016 now enables them to provide certified organic products year-round. If you're having trouble or difficulties connecting to the webinar, please call our office for support, 831-423-2263, and press 0 for the operator. My name is Jessica Parr, and I'll be your host today. I'm the Assistant Director here at CCOF, California Certified Organic Farmers. CCOF is a nonprofit organization that advances organic agriculture for a healthy world through organic certification, education, advocacy, and promotion. And we envision a world where organic is the norm. We're very excited to have 3 wonderful presenters here to represent 3 different perspectives on getting organic produce into hospitals, including Kathleen Reed, who's the Sustainable Food Program Manager at healthcare provider Kaiser Permanente here in California, Robert McClendon from McClendon Select, a CCOF certified organic farm in Arizona, and Ben Thomas, who's a procurement specialist for Community Alliance with Family Farmers. I will introduce each speaker in more depth prior to the presentation. Before we get started with our first speaker, I wanted to review a few housekeeping items and let you know how you can participate in today's web event. We're looking at an example of the GoToWebinar attendee interface, which is made up of 2 parts. The viewer to the window on the left, which allows you to see everything the presenter will share on their screen, and the control panel at the right. Within that control panel is how you can participate in today's event, so let's look at that. By clicking the orange arrow, you can open and close your panel. From the View menu, you can also set the control panel not to auto-hide when inactive if you prefer to keep it always open. The audio pane provides audio information. The organizer has given the attendees a choice, and by default, you have joined the webinar via mic and speakers. Click the audio setup to select your computer speakers or headset devices. And if you prefer, you can join the audio via telephone by selecting Use Telephone, and dial-in information will be displayed. During and at the end of the presentation, you'll have the ability to send questions to our webinar staff through the questions pane. And your frequent hospital. And thank you again for attending today. So really quickly, I'm going to introduce Kathleen Reed. Kathleen has served as Kaiser Permanente's Sustainable Food Program Manager since 2008. Reed designs and implements systems to manage and expand KP's national food programs, including Sustainable Food Sourcing Initiatives, Farmers Markets, the Healthy Picks program, and KP's food-related environmental initiatives. Reed leads KP's effort to increase the organization's purchasing of sustainable food, which now includes beef and chicken from animals raised without antibiotics or added hormones. Reed also serves as KP's National Farmers Market Coordinator, supporting the success of more than 50 farmers markets and farm stands at KP facilities in 5 states. An avid organic gardener, farmers market enthusiast, and cook with a passion for foraging and preserving urban fruit, Reed has an extensive background in sustainable agriculture and 2 Masters of Science degrees from the tool development, and the chemistry. Me in giving a silent welcome to Kathleen Reed, and Kathleen, feel free to take it away.
Thank you so much, Jessie, and thank you to CCOF for inviting me to speak today. Welcome, everyone, to the webinar, and in the next 10 minutes, you will learn about Kaiser Permanente, our sustainable food sourcing initiatives and farmers market program, trends in sustainable and organic purchasing by hospitals, and some considerations for producers looking to tap into the hospital market. Jessie, I wanted to ask, well, yeah, there we go. Thank you. I'm going to make sure I can advance my slides. Thank you so much. So the first thing I wanted to share is to give you a snapshot of Kaiser Permanente, where we are located and our scope and scale. So we have 10.6 million members. The majority of our business is in California and on the West Coast, though we have some business also in the middle of the country and on the East Coast. We have 38 hospitals, and we have approximately $32 million in food spend. So I will talk a little bit about our journey from farmers markets to healthy food to sustainable food and how that has evolved over time, and also the various areas in which growers can potentially tap into our market. So back in 2003, Dr. Preston Mehring, one of our physicians, founded one of the first ever hospital-based farmers markets at the Kaiser Permanente Oakland Medical Center, and that farmers market program has grown and expanded to about 53 farmers markets and farm stands in 5 states. The products that we sell at those markets include organic, conventional, and a combination of products depending on the market. So some of our markets are 100% organic, some will have both conventional and organic produce, and as I mentioned, some will have a little bit of both. And the primary focus of our markets is really to provide fresh local produce to our community, to our employees, and to our members. So that has been the main focus, and it has also expanded to include some prepared healthy foods and other products. So as mentioned again, also the farmers markets, we have some locations which have CSA programs. So some areas where we aren't able to have a full-fledged market, a CSA program or a Farm Bucks program has started up, something like if you're familiar with some of the Farm Bucks programs in the Bay Area, some of them are direct from farm, and some are kind of consolidating some organic produce and conventional produce. So Kaiser Permanente also has a very robust environmental stewardship program. The key areas that we focus on are climate action, safer products, sustainable food, water conservation, and waste reduction. So sustainable food overlaps with a lot of these other areas in terms of, how it impacts climate action, how it impacts things like, the packaging of our food. So there's a lot of overlap among these, but the main goal is really to promote and support healthy food systems by sourcing products that are local, seasonal, nutritious, and produced in a way that minimizes degradation to human and environmental health and vitality. So that's one of the big focuses of our sustainable food program. And I will talk a little bit more about some ambitious goals that we have in all of these areas, in particular with relationship to food. So Kaiser Permanente, back in 2009, developed some sustainable food purchasing criteria. We have criteria in 9 different food and non-food categories. I am highlighting today the produce category so you can understand kind of what that criteria looks like. So Kaiser Permanente, when we are sourcing products, sustainable food products, we look for items that meet at least one or more of our criteria in each food category. So for example, in produce, we're looking for products that are produced on a small to medium scale farm, locally produced within 250 miles of our facilities, and or third-party certified as humanely or sustainably produced, which includes USDA certified organic, Food Alliance certified, Fair Trade certified, and some of the others that are listed here on this slide. So this is the criteria for produce. We have other criteria that are related to meat, to poultry, to dairy products, and so each of those criteria are slightly different based on the product, and I can share that after this presentation if someone is interested in seeing more detail on the specific criteria. So some of the considerations when I think about producers who may want to get into the hospital market and sell to hospitals like Kaiser Permanente or other healthcare systems, some of the key things to consider in terms of trends in the healthcare industry in terms of sustainable food are that there's really an increasing interest among hospitals to source sustainable food, not exclusively organic, but some of those criteria I mentioned previously, and also in terms of the healthcare market, food safety is a very high priority because we're dealing with vulnerable populations, but we also have, healthcare is very strictly regulated, and therefore we really have to make sure that the products that we're bringing in for our patients in particular are, meeting the highest standards for food safety. Another consideration is in the hospital system, there's a big need for processed products. So, for example, something like broccoli, if we were to source broccoli that's not chopped and washed, there are huge impacts on labor. And so we're looking for products that are local and or sustainable or organic that are also processed. So that's one thing that we're trying to find more of and trying to increase the availability of those products for our patients. The other big consideration, I would say, is the affordability of sustainable, local, and organic products. This can be one of the biggest barriers for healthcare in terms of bringing those products into our food system. So the next thing I wanted to talk about is just some of the challenges we have found over the years in terms of local and sustainable produce sourcing. And I would say in particular for organic, the price point is a big challenge for us in terms of finding products that are meeting our price point and that allow us to still provide affordable health care. So a second one is availability, and when we look for, and I'll talk a little bit more about how Kaiser Permanente, sources our produce in a few minutes, but I think these challenges are not just faced by Kaiser Permanente, but I also see them and hear them in speaking with other healthcare systems that are interested in sourcing sustainable and local produce and other products. So availability of product, as I mentioned, it's sometimes hard to find, for example, local and or sustainable or organic processed product that we can use on our patient meals or in our cafeterias. And this is something that we've been working on, over the years with other hospital systems, with organizations like CAFF, to see if we can find ways to get those products to a place where they can be processed. Another thing is in terms of availability, is that we serve, Kaiser Permanente in Northern California, for example, serves 6,000 meals a day. So to find the quantity of product that meets our needs, that also meets our sustainability criteria, can be challenging, so that we can serve it to, across our patient menus or across our cafeteria menus. So distribution, one of the challenges with distribution is just being able to get the products from a small to medium scale farm, a local organic farm, into our distribution system. We typically don't source directly from farmers. We typically try to get the products through our regional produce distributors, and so ideally we like to get products that can feed into that, whether they're coming from a produce sourcing hub or whether they're coming direct from the farm to the distributor. This makes it easier for us in terms of not managing many different invoices and accounts, so there's a potential operational impact there in terms of managing multiple invoices and vendors, but also multiple drop-offs. So we really, we consider that as well in terms of the operational impact and the distribution of the products. So for marketing, one of our challenges with marketing is that, for example, in our Northern California region, we produce all of our meals for 21 hospitals in one central commissary. In that location, all of our produce is dropped off at that location, the meals are produced, and they're sent out to all of our hospitals in Northern California. So we, in terms of making sure that each of the items that we source is to basically have it source identified when it gets on a patient meal, that has been a challenge for us. To track it through the process and to have something on the patient tray, for example, saying this product is organic from this farm. In terms of sizing and consistency of the products, with our patient menus, one of the considerations is that in terms of the nutritional impact of the item, for our patient meals, we are working with therapeutic diets where there might be limits on, for example, carbohydrates or other nutritional specifications. So if we have very large or very small pieces of fruit, for example, that can be challenging. So we try to look for ways to use the products creatively if they come in at different sizing, and it's certainly easier to do that in some of our other regions where we have a cafeteria and patient meal a service is being done in the same area. So another area that another challenge for us is the planning the menus around seasonal produce. There are a lot of implications to changing the menus or changing the menu items on a regular basis in terms of how we manage our menu system on the back end. We have a system called Seaboard, a nutrition database where we manage that, and so it can be challenging sometimes to shift those menus, also in part because of nutritional requirements by the patients. So these are some of the areas that we find challenging. Despite these challenges, we have made quite a lot of progress in sourcing sustainable and local produce and other types of foods. So we are currently at about 24% sustainable food spend. This includes produce, dairy that's RBST-free, produce that is raised, that is grown either organically, locally, or from small to medium scale farms. It includes also meat and poultry raised without antibiotics and other types of products. So our goal, we have a fairly ambitious goal to reach 100% sustainable food by the year 2025. And this is, it's very exciting for me to be presenting to all of you because you are the potential source of some of these products that will help us to shift to our 100% sustainable food spend. So it's great to be able to send that message to the people who are actually growing the food. So I truly appreciate being able to share this with you. Moving on to what Kaiser Permanente does and how we do our produce sourcing. Our produce is sourced typically through regional distributors in our Northern and Southern Cal region. As I mentioned, those two regions make up the, I would say, 80 to 85% of our business. So we also have hospitals in the Northwest and Hawaii, but the two Northern and Southern California regions are the areas that we, as I mentioned, have the most purchasing of produce and other products. So the food production infrastructure in each region is slightly different. In Northern California, I mentioned most of our products come in through one central commissary, and therefore it's a little bit easier to manage making sure that every facility is purchasing a sustainable product that we put on the menu. In Southern California, each location purchases separately. Each hospital manages their own kitchen, and therefore it's a little more challenging to standardize across the region and make sure that everyone's purchasing the sustainable products. So 2 key points of entry that I could see for producers to provide sustainable or local or organic produce to Kaiser Permanente are through a distributor who meets the Department of Health standards for an approved vendor, meeting all the food safety standards, and also through our farmers market. I would say the volume is much higher through the distributor that would serve our patient meals, cafeterias, at our medical centers. At the farmers market, volume is much lower. However, there's certainly a demand for organic and local produce. I did want to excuse the background noise. There is a testing going on in the background, so hopefully that's not too loud. So we have sustainable food partnerships with many outside organizations, including Community Alliance with Family Farmers, who has been an amazing partner over the past, I would say, 10 years in helping us to source more local, sustainable, and small to medium scale family farmed produce. And I know that Ben Thomas will be speaking soon about some of the initiatives that they're working on. Healthcare Without Harm has also been a great partner to us, and we have worked with them to collaborate with other hospitals and to learn what other hospitals are doing and share information about how we can increase our sustainable spend. So I think that many hospitals across the country, I think hundreds, have signed the Healthy Food and Healthcare Pledge committing to sustainable and local and organic food purchasing. So at least all of those hospitals have made a commitment to that and could be potential markets for organic growers and for sustainable and local growers. Physicians for Social Responsibility has organized hospital leadership teams where we collaborate, again, with other hospitals in our region to identify opportunities to source more sustainable food, whether it's produce or other products. And I know that, again, that Ben will be speaking a little bit about some of those partnerships. The California EdMed Collaborative is a group of hospitals and schools that are working together in California to leverage our volume and find ways to source more sustainable and local products, from produce to chicken raised with antibiotics, lots of other products. So it's an exciting new partnership that will, I think, have a big impact on the market. So some recommendations for organic producers who may want to get into the hospital system. One key thing is really to meet and document food safety requirements in your operations, so that you are meeting those requirements required by the distributors and hospitals you might want to serve. Another thing I would recommend is connecting with hospitals through CAFF, through Healthcare Without Harm, and through Physicians for Social Responsibility. Establishing relationships with regional distributors is also a good way to get into hospitals to find out which of them might be serving hospitals. And there are many in the Bay Area that are working with hospitals like Kaiser Permanente and who have been asked by hospitals to find products that meet organic or other certifications. So I would advise that as another way to connect with hospital markets. Focusing on produce items that are commonly used by hospitals, that's another key area, and I think, again, Ben may be speaking a little bit about some of the work that CAFF has done to identify those types of items and work with hospitals. So I will now open it up to questions, or perhaps the questions will come at the end. I'll hand it back to Jessie to take it from here.
Sure. Thanks so much, Kathleen. That was really excellent. We did have a whole lot of people write in, so we do have some questions. First, to kind of harken back to that test run for the question pane that we kind of prompted folks, we had several folks write in. We had somebody who works in nonprofits who helps get healthy and sustainable food into hospitals and healthcare facilities. We had another person write in who's a student at the Middlebury Institute of International Studies, who's part of a micro-enterprise consulting group that's working with a local organization, California Farm Link, to help small organic growers in the area look for additional markets for their products. So thank you for those of you guys who kind of went out on the limb and tested out the question pane. And we have a whole bunch of other questions that have come in since. So first, is a question about your definition of local, Kathleen. So what is the distance from end to end that Kaiser Permanente considers to be local?
So we, our current definition of local is within 250 miles of our facilities, or facility that's sourcing the food. And we, we acknowledge that that is, it's an arbitrary number in some ways, and we certainly would like to source more California produce, more, more United States produce, and then kind of going outward, with local being the priority. However, we need a number basically in order for us to track how we're doing. How are we doing? Are we sourcing, what percent are we sourcing local? It doesn't mean that a product that's outside of that radius would be considered, the same as anything that's international. It just means that we, it's a way for us to kind of track how we're doing in terms of sourcing kind of regionally within our Northern California region and our Southern California region.
Got it. Thank you for that. Similarly, what's the percent of organic produce that Kaiser Permanente is currently sourcing? At least if you can talk to the Northern California Kaiser Permanente, perhaps?
Yes, I think, I don't have exact numbers on that, but I think we are somewhere around 5%.
Got it. That's more than the percent of organic produce grown in the United States on an acres basis, which is about 0.5%, in case anybody was wondering.
And I believe that shifts over time, obviously, with the seasons. So, depending on what's available at season.
Yeah. Similarly, we had a question for you. Is it harder to reach your sustainable percentage goal in locations with colder climates versus California? And if so, how is Kaiser Permanente dealing with that barrier?
I would say it is to some degree, but it is to some degree. Even, I mean, I see it with our farmers markets, for example, in terms of what products are available in the winter seasons versus the summer season. If you compare our Northern California markets versus our Southern California markets, I would say it can be more challenging, but I think we've actually done quite well in our Northern California region, in part because of what I mentioned with the commissary. When we decide that an item is going to be, we're going to source, say we're going to source local strawberries, it's, it's going immediately into 6,000 meals instead of kind of each facility doing their own thing. So that has been an advantage to us in the Northern Cal region in terms of advancing that, the progress in meeting our goal.
Yeah, that was just a follow-up question to further clarify that point. Someone asked, does the centralized kitchen system make fresh, local, organic easier or harder integrating those items?
It can be easier because, as I mentioned, there, we don't have each individual facility. The facilities are definitely involved. We have 21 facilities in Northern California, and they are, each Food Nutrition Services Director at each facility makes, weighs in on the menu and which items they would like on the menu. However, because the actual sourcing is done in one location, it does allow for, I think, a bigger impact and a more consistent impact across those facilities in terms of increasing the sustainable spend. We've seen that our Northern California region is moving more quickly than our Southern California region, and we're working right now to just expand or to standardize better in Southern California in terms of getting more local sustainable products across all of, we have 14 facilities in Southern California, across all of those facilities more consistently.
Thank you. And then we have one more. Is Fresno in the northern or southern region of Kaiser Permanente?
Fresno is actually part of our northern region, Northern California region. Yeah.
For those of you outside of California, Fresno is kind of smack dab in the eastern side of the state, in the Central Valley.
Yeah, so it's served by our Northern California commissary.
Got it. We have a whole lot more questions that have been coming in, but I think we're gonna pause on the questions and we'll get back to them, and we're gonna move on to Bob, if that's okay, Kathleen. So
great.
Thank you so much for that great detailed presentation, and we'll save the other questions for later on in the presentation.
Thank
All
you.
right. So I'm going to introduce Bob real quick. Oh, I guess I'll ask one more question. Sorry. What do you perceive as the biggest barrier to getting a product into a hospital? So that's kind of like a pop quiz. What do folks think the biggest barrier to getting products into a hospital is? And that's just it's kind of a learning question for all of us here that are helping put this webinar on. All right, so Bob McClendon is the owner of McClendon Select, a family-run CCOF certified organic farm in Peoria and Phoenix, Arizona. 3 generations of the McClendon family manage a total of 93 acres of organic land. They grow over 100 varieties of organic fruit and vegetables, along with dates, honey, and citrus. Through their partnership with Cancer Treatment Centers of America, McClendon Select developed the first organic farm in conjunction with a hospital. The McClendon family grows on 68 acres of the CTCA hospital campus in Phoenix, Arizona to provide products for the hospital and other customers. McClendon Select also markets their products at farmers markets in Phoenix, Arizona, as well as in award-winning restaurants throughout Phoenix, Tucson, Flagstaff, and Sedona, Arizona. So welcome, Bob. We're going to turn it over to you. Thanks so much for making the time and being here with us.
Good. Thank you very much for the opportunity. I just need to know how we're going to advance the slides. If you can give me control, please.
Pretty sure you have control. I'll try again. Okay, you can try now, Bob.
Okay, I'm trying to advance.
Oh, not happening. I'll advance them for you.
Okay. You just need to give. I'm not ready to go there yet. But to just tell me, give me control, and just tell me again how to do that.
Oh yeah, sure. So I'm going to give you control of the keyboard and mouse. And all right, you should be able to see if you can advance them now.
Okay, and I would do that using the up and down key, right?
The side-to-side key, I think. Well, looks like we might be having some technical difficulties. If it's all right, Bob, you can just say to the next slide, and I'll do it for you.
Okay. Thank you very much for the opportunity. We farm a total of 93 acres in the Phoenix metro area. 2 locations are 19 miles apart. Our home farm is 25 acres, and it's located in the city of Peoria. The Goodyear farm is 68 acres, and it's located on property owned by the Cancer Treatment Center of America. Can we go to the aerial slide, please? That is a picture of our home farm where where our whole operation started. We started growing citrus, dates, and did our own honey 35 years ago on this property, and it has continually evolved to where we became certified organic in 2005, and we ran out of room pretty rapidly as our business grew. Please advance the slide to the CTCA aerial. So here's where the story really begins. Our business is family-owned and operated. Myself, my son Sean, my daughter-in-law Kate, and my wife Marcia are in the management side of this business, and also work 7 days a week during our season. Because it's so hot here in the desert, our season really begins about October 1st and ends around the end of July. We can grow just a very few things in the months of July, August, and September. Our business employs 20 full-time people and 8 part-time employees. Our customers are comprised of 40% farmers markets customers, and we do 3 large farmers markets a week. 60% of our business we custom grow, specialty grow for restaurants all over the state, with the majority of them being concentrated in the Phoenix, Scottsdale area. The whole thing began with our relationship with a hospital about 5 years ago, and on the screen you'll see the hospital that sits on 25 acres, Cancer Treatment Centers of America. They own 250 acres plus that stretches for 1 mile wide, and they bought the hospital. It was all ag land, all had been conventionally farmed for decades by tenant farmers. And they built the hospital, which you'll see in the upper left-hand area of the screen, on 25 acres. About 5 years ago, the chef that was in charge there of their culinary staff, they've always had a mandate to use as much organic, naturally or wild-caught fish, naturally grown, and organic products for the food. And they don't just do that for their patients, but they actually provide food for patient caregivers. They provide food for all of their employees, and anyone can go in and eat there also. And they have a very high level of quality, a very extensive, modern, beautiful kitchen, talented chef, and the food has been outstanding for everyone involved. So chef that you see here in the picture, his name is Frank Caputo. About 5 years ago, he contacted me and wanted me to sell our organic produce to him. And I told him no, because at that time we were so busy we weren't taking any new customers. And I thought maybe he would go away, but he kept calling me, and finally I decided I'd better go take the opportunity to pay him a visit and get a tour of their facility. And after I did that, I was so impressed with what they do that I agreed to take them on as a customer. And I personally did the deliveries because it was kind of out of our delivery zone at that point in time, and couldn't help but notice every time I did a delivery, all the beautiful agricultural land that this hospital was surrounded by. And upon querying a little bit, I found out that they actually own that land and leased it to the tenant farmers. It was all conventional at that time. At some point in time, after we'd had a relationship for probably almost a year, the chef and I were talking and came up with the idea that it would really be nice if he could have an organic farm there. And it was really at a time when our 25 acres, we were just out of space. We had no room to expand our business at all. So we started talking and put together a plan, and it went to their board of directors, and they said, yeah, we'd like to take a look at it, put a pencil to it. And then they got estimates, because when it had been farmed, it had been farmed for the last at least 60 years out of open ditches, siphon tubes, and it was just all row crop type farming, not set up to do vegetable growing where we need to water things much more frequently. And I just designed a situation, a farming situation that I thought would be an ideal, optimum situation where we use drip irrigation. Let's go back to the aerial of the hospital. And here you see this, when this picture was taken, the 25 acres directly to the right between the freeway and the hospital was fallow. We were in between planting. This is taken in the middle of the summer. And then there's another 43 acres down a little bit. There's my, I've got my mouse. Another 43 acres that is in vegetables, and everything here is drip irrigated. The open ditches, the siphon tubes are all history, and we laser leveled everything, built right there. You'll see a kidney shape. We call it a lagoon, and it holds 8 million gallons of water, and we have a sand filtration system, a pump, and we can pump water all over the area that we farm. The green area that you see where the mouse is, that is in wheat at this time. No, I'm sorry, that's in alfalfa at this time, and that's being farmed conventionally. So we had to go through the 3-year wait period on the 25 acres directly behind the hospital. The 43 acres, 43 acres that we recently took over had not been farmed for 12 years, so we were able to get it certified by CCOF and ran water down through the middle of that and could drip irrigate everything to facilitate our farming operation. The relationship is such that the hospital can harvest anything that they want that we're growing whenever we say that it is ready. And let's go to, you can see, you saw a picture of Chef Caputo. And there's the culinary staff, his culinary staff at that time the picture was taken. And let's go to another slide. You'll see that was after the lagoon was built and lined so that we did not lose any of the water. All of our water comes from wells and flows to a canal system, and we keep the lagoons filled and can turn a switch and pump water anywhere on the place for our drip irrigation system. And let's go backwards with the slides. Culinary staff again. We had a little area right behind the hospital which we call the patient garden, and we had just a few things planted, which you'll see Chef Frank with a head of cauliflower standing in, and that was a nice place. A lot of patients, when they wanted to get out of the hospital in between the chemo or the X-ray treatments or whatever, they could walk out there and kind of get close to nature and leave that hospital environment. The relationship is probably the best example of a symbiotic relationship that you could ever find. This hospital is dedicated to caring for their patients. They are convinced and use organic, wild-caught, try to avoid as many chemicals and pesticides as they can, since the evidence is pretty clear that a lot of cancer is caused by our environment and the sea of chemicals that we all live in. So by reducing those chemicals everywhere that you can, the theory is that maybe you can reduce the incidence of cancer, and maybe when you're treating cancer, you can improve the outcome by using good, clean food. And right now, I think that is pretty well covers, what happened and what we did. It's been a great relationship. The staff can go pick anything they want, anytime they want, as long as it's ready to pick. And but with as much ground as we've got and with much as we're growing, they can only pick a small percentage of what we grow. The rest of it we use in our business of supplying restaurants and farmers markets.
So, Bob, thank you so much for that. There are a few questions that have come in, and I encourage people to write in more. It's really a fascinating example of how hospitals can work together with organic farmers, and like you said, seems like a perfect symbiosis. So, from some of the farmers in the audience, we have some curiosity. So, do you have a lease with Cancer Center Treatment of America, or is it a crop share agreement, or what's the legal structure around it, and what's your tenure on that land?
We have, excuse me, we lease the ground. There's two leases, one for the 25 acres, because that's the first one we did, and then one for the 43. We lease it at rates that are comparable to what the conventional farmers are paying for ground owned by the hospital. And then we volunteered to supply the hospital with it. All they have to do is go harvest it and wash it and take it into the kitchen, and they can have as much as they want. So that is the business arrangement. The tenure of the lease, because unfortunately this area is a rapidly growing area, and that especially the 43 acres that you go back to that picture if you would of the hospital. That 43 acres that you can see with all the green lines of our crops is highly valuable ground that you could never afford to buy to grow on, and at some point in time that could be sold. So we have 5-year leases that are renewable, and we would like to think that we can go as long as we can. The back 25 acres behind the hospital is probably not as marketable or usable, and that probably is secure for over the long term.
And then a follow-up question to the idea of the hospital staff being able to pick what they need for the kitchen. What's the percentage that the hospital ends up using from those fields? Is it 5% or 10%? Have you calculated that?
We've never calculated because we don't keep track of it. I can't answer that because they have free hand at whatever they need, and we don't track it. That's kind of a little bonus for them.
Got it. An additional question was, what was the most important factor in building the relationship with Cancer Treatment Center of America? What was it that kind of, if you could give somebody the special sauce of how it happened, and helping create that relationship that is clearly so special. What would you say that ingredient was?
Probably need. We needed more ground to grow on, and they truly wanted to use as much as possible local organic produce in their hospital to feed their patients and their guests and their employees. And they were previously to us starting to sell them produce. They were buying as much as they could organic from meat purveyors and produce companies. So this was really a major goal for them to provide good, clean, honest, local food. And it came together to where we both the hospital and McClendon Select have very large investments in this project. We're not partners, but they have certainly invested in this, and we have invested very heavily in just equipment alone.
Yes, we thought I kind of forwarded over the picture of you and your son on the tractor, but it does look like you're heavily invested in the equipment end. We had another question.
Yeah, that's it.
That's the equipment. There it is. Beautiful New Holland tractor.
Yeah, that's just a very small portion. Whenever you have a tractor like that, we also have a new T7 New Holland, but that is even though that T8 is a $250,000 piece of equipment and the T7 is 170, that's just the beginning. It's what you put behind those tractors that add up tremendously.
Yes, yes, indeed. Do you think, Bob, this is another question, do you think that the sustainable food model used at Cancer Center Treatment of America is feasible or affordable for other hospitals to do?
The answer is I don't think it's feasible because you're not going to find very many hospitals that own 300 acres or 250 acres of land surrounding them that is arable.
That is a question. Maybe Kathleen can help illuminate that for us. Kathleen, are there many hospitals just, with Kaiser Permanente that have agricultural land that are around them? Do you know?
I believe there are some, but I think there's some probably legal and other challenges around using that land to grow food. So I know that has been considered by Kaiser Permanente, and maybe it will be again in the future, but I think there's some challenges with doing that. So at least from our perspective, I have seen, because I'm involved with Healthcare Without Harm and Physicians for Social Responsibility, I've heard a lot of very interesting stories about hospitals around the country who are able to at least have a garden, not necessarily the scale of Bob's operation, but something smaller. And I'm sure there's potential there. I think it's getting past some of the logistical and legal barriers, perhaps. But it certainly would be worth approaching, I think, hospitals about it.
Yeah, there's a question from one of the participants about how to make this a standard in the industry, which is, just coming from the perspective of, growers would be fabulous, right? At the, amazingness of having an institution that has the resources to be able to put behind, saving agricultural land that could go to development and, putting it towards the good use of having an organic farm on it. But it seems like a pretty special situation to have, institution that's aligned with sustainable organic, food purchasing that happens to be on 100 acres of agricultural land. Would you guys agree that that's a pretty special situation?
Yes, there's no question about it. We think that's the only hospital in the world that has this kind of a relationship. And again, hospitals are, one of the things that I really enjoy seeing is hospitals are starting to move away from having their food services run by dietitians who serve a very, very good purpose. And I'm not trying to denigrate dietitians at all, but they're bringing in trained chefs, CIA, Culinary Institute of America chefs, that can make things taste good. And that's something dietitians typically, they're into all the nutrition and the calories and the sodium and potassium and all that good stuff, but very few of them really know how to cook and make things taste really good. And sick people have all kinds of taste impediments. So, for instance, Cancer Treatment Center of America will actually formulate diets that taste good for particular specific patients. And I don't think you'll find that anywhere else in the country. So it's a very special operation here in Arizona, and we're very fortunate.
This is Kathleen.
Go ahead.
I would have to agree with Bob that I think that there is this trend in the industry. We're seeing it within Kaiser Permanente and at many other hospitals to move to having chefs, and it's really making a huge difference, I think, in the quality of food at hospitals, which has historically been, perceived as being terrible, and maybe was terrible, but it's really shifting, I think, the quality and the way of the food and the way it's prepared in a way that just, I think, benefits everyone.
So I wanted to take a moment to bring Ben Thomas onto the line. Ben's been the silent third presenter. I'm sure he's been holding his tongue. So Ben serves as a procurement specialist at the Community Alliance of Family Farmers, which is a nonprofit based in Northern California. And Ben provides technical assistance to farmers selling their products to hospitals and schools, and works with institutional food systems buyers to engage within the local food system. Ben has worked with college and university sustainable food procurement and education since 2009 and joined CAFF after managing the Sustainable Food System Department at the University of California, Davis Dining Services. He currently works directly with 6 hospitals in the Bay Area and Sacramento regions of California to source more fruits and vegetables from local family farms. So Ben, do you want to weigh in on this before we get to your formal presentation on the conversation that we're having right now? Hello, Ben. You're still on mute. There we go.
Oh, there we go. It was giving me a hard time on reading. Thank you. No, I can jump in, but I just wanted to add to that there's the McClendon's model in Phoenix is really ideal, like he was saying, having that much arable land and being able to do that right in that close in conjunction with the hospital. But here, at least in Northern California, Mad River Hospital and Redwood Memorial are both have significant gardens that they're able to now bring food into their dining services with, and there are other hospital systems around the region that are with increasing frequency asking us for support, mainly navigating the regulations around most are community growers, as the land is not usually zoned for agriculture. So in California, you fall under a designation as a community grower, and there is a limitation on selling to patient food services. But it's really not completely clear where that line is drawn based on the origin of the legal relationship and the approval of the growers. So we're in the process of trying to develop resources and publish them to make that more accessible for farmers and for hospitals to be able to further develop doing more gardens and farms on the hospital properties. It seems like there is quite a significant amount of interest and a readiness for investment, and at least enough land for some of the food sourcing. So we'll hopefully be able to tell you more about that as we go this year.
All right, thanks so much for weighing in, Ben. And we have a lot more questions coming in, which is fabulous. I'm going to just take time for one more for Bob, and then we'll move on to Ben's presentation. So Bob, has Cancer Treatment Center of America noticed an improvement in patients' health or recovery as a result of the farm collaboration? Do they speak to you about that type of thing? Is that something that anybody's tried to measure?
That's probably impossible to measure. Really, I don't think you can measure that. And eating healthy is a long-term proposition that can't be measured in just during a hospital stay. So another thing that this hospital does that I was very impressed with is that they teach patients how to cook food in a nutritious manner, emphasizing buying local and organic. And then they teach them if they don't know how to cook, and you can't believe how many people in this world don't know how to cook. But I was shocked. But they actually teach them how to cook and prepare good tasting, healthy, local, organic food. So they look at it from a perspective of what happens to the patient after they leave the hospital.
That's really brilliant. That is awesome. Thank you so much, Bob, for sharing all of the different stories about your relationship with Cancer Treatment Center of America. We're going to move on briefly here to a question. What are successes or challenges you've had with selling your product to hospitals? So that's a question for all the growers on the line. And with that, Ben, I'm going to turn it over to you. We've already done your introduction, so feel free to take it away. I think you're on mute again.
All right. Thanks. So just waiting on being able to change the slides as well. There we go. Okay, so today I'm going to be discussing the relationship that we have with Healthcare Without Harm and a group of hospitals in the Bay Area who have made it a priority through the Healthy Food and Healthcare Pledge to source local produce from identified family farms. I'm going to talk to you about the way that the primary avenue to connect with hospitals currently in California is through their existing distributors. And so I'm going to talk to you a little bit about the barriers for the distributors and growers, which I'm sure many of you are well aware of, and then some of the challenges for food service directors ordering in hospitals that we've been experiencing with our relationships with them. And then the strategy that we have, bringing together hospitals as well as schools and universities to align their local needs and purchasing requests and our coordination with their distributors to make that possible. And that's called a purchasing collaborative model. And then in following up, some different ways that we found to reach hospitals for farmers. To give some background, CAFF is the Community Alliance of Family Farmers is a 40-year-old nonprofit that works statewide in California to build sustainable food and farming systems through policy, advocacy, and on-the-ground programs. So we're both moving and shaking on the ground as well as working in representation in the state legislature to create more resilient family farms, communities, and ecosystems. Some of our work right now also includes helping farmers become prepared for food safety certification, working to help demonstrate ways that farms can access ag cap and trade money through sustainable practices, and the farm-to-market work that we're doing, which includes farm-to-cafeteria as well as some direct and retail support for farms. And I also wanted to mention that a family farm, by our definition, is a farm that is owned and operated by, that is privately held and owned and operated by the family that owns it. So for the most part, that's primarily organic and transitioning farms and also many conventional farms that are of the small to mid-scale, and our focus is on produce. So with the distributors that we work with, there are about, in any given distributor, about 8,000 product SKUs related to that, each fruit and vegetable size, cut if they're pre-cut, quality, and variety. But farm name is not included in that. And thankfully, with a great deal of demand and requirement for tracking and reporting over the past 5 or 10 years, especially from institutions, there has been a movement for many distributors to start putting in place both practices and software that track that farm name from when your farm name is included in all of your GFSI food safety tracking and it gets to their back dock to when it reaches their customers. But that can be really challenging for food service in hospitals and schools. And that's because they're not ordering on a daily or weekly spot market for the most part. They really need to have 2 to 4 weeks planning to be able to meet their nutritional guidelines and to be able to add that value with getting marketing out to all of their different food service directors and order information, and then be able to have that item ready when they're ready to order it. And so most of the work that we do is to get distributors to see the value and realize that value and be able to provide that information and availability much farther in advance than they're used to. And also for that to be from local family farms, so the farms that need it the most and are really looking to access this market. There are also barriers, especially in the hospital, also challenges, I should say, especially in the hospital market, of large requirement for GAP certification and insurance minimums. So about 3 out of 4 distributors that we work with hospitals are requiring third-party GAP certification and requiring an insurance minimum of at least $1 million. And so being able to reach that, to be able to work with that market. I just also wanted to mention that there is a really significantly growing demand across institutions for local produce, and that's very much embodying organic produce as well. And this is in part because of where we are in Northern California and the prevalence of organic production here, but also because of hospitals really prioritizing organic produce. And that I would say at least half of the farmers, and in this example that I'm going to be giving you with one of our purchasing collaboratives, at least half of the items that are being offered to hospitals from their distributors from local farms are organic. Organic is also, as Kathleen touched on, a priority of Healthcare Without Harm's Healthy Food and Healthcare Pledge, and it's also part of this growing demand where in California, a quarter of hospitals have signed that pledge, and 350 schools are participating in farm-to-school efforts, which almost entirely includes local produce as a priority. 60% of them surveyed last year would like to buy more local produce. And on the farmer side, from our own surveying at CAFF in the last few years, almost half of growers have interest in expanding their markets, including to institutions. So it's a really good match with a little bit of extra coordination to be able to figure out how to navigate reaching hospitals and schools in a not particularly transparent market or supply chain. And then the food service directors, and I mentioned this earlier, but are also facing major time crunches, budgetary restraints, and are heavily regulated. And so it can be time-consuming and risky to work with vendors outside of their regular distributors, and it also can be difficult to meet their volumes with local farm and organic farm availability. And so we work with them to both promote local farms as they want to work with additional vendors, as well as work with their existing distributors. And in the case of the project that I was talking about, that I was mentioning earlier, increase the ability to source from farms that are able to lease land on hospital land. But with that said, there's also a major movement by food service directors to move forward with limited capacity in terms of their production in-house and with limited budgets, but to really be able to creatively solve those challenges and feature organic and local produce, not only during days like Food Day and Earth Day, but really throughout the year. And that's also embodied by the farmers market work that Kathleen and Kaiser are doing. And so we work with purchasing collaboratives, which is when we work with any network. So for example, in the Bay Area, for about the last 10 years, there have been a group of hospital leaders getting together anywhere from monthly to quarterly to share their best practices, share their challenges and their opportunities. And in the last several years, Healthcare Without Harm, with some support from CAFF, have been facilitating that group. And from that, we found that almost all of the, about 4 or 5 of the hospitals in that group, as well as several of the schools in the California Farm to School network that we work with, all had the same distributor in the Bay Area. And so we got together with those schools and hospitals, and to really simply frame it, it's an informal group. It's not like a purchasing cooperative where they're legally bound to each other. It's an informal group in which, instead of having, in say, 4 or 5 hospitals and 3 or 4 school districts, having 30 or say 30 people that are responsible for ordering in different capacities, all reaching out to a distributor and trying to create that consistent communication to be able to feature a local item. Instead, we get everyone together and find out their common needs, their common definition of local food. If they have priorities such as organic certified produce, which has absolutely been the case in this Bay Area group, and whether they have any production needs like having those items pre-cut. Once we do that, we go to their distributors and try to explain what those needs are and what kind of schedule the hospitals and schools need that are working with them, and just provide that intermediary communication support that the food service directors and the distributor generally would not have time for in their regular schedule. So the idea is that one school or hospital, while they often have large volumes and are really significant thought leaders in their communities, can seem with relatively limited budgets and price points that they are not able to really significantly move a system to allow to more easily access transparent grower-identified produce. So we have this example that I was telling you. This is just a little visual of having many different distributors all trying to reach their, many different schools and hospitals all trying to reach their distributor. And what we try to do is bring them all together and really make that a more direct and easy communication that adds value for both the distributor and the schools and hospitals. And so we meet with food service directors to understand what their needs are, and then to create a calendar for them for the whole year. So that calendar will ideally have both pre-cut and whole fruit and veggie items, at least one of each, one per month throughout the year, that we work with their distributor. Most often it's with their distributor's existing local farms that meet that definition of being a family farmer. If they require GAP certification or insurance minimums, that they have those. But then we help backfill for those distributors and connect them with new farmers who are interested in reaching those hospital markets or are ready to sell to wholesale markets. And often those food service directors will specifically request being able to work with farms in their areas. And if that's the case, we'll help that distributor connect with that farm and be able to provide that for their customers. In the short term, our goal is just to get a consistent availability and ordering of local produce items with signage. And I'll show you some examples of the signage. But our long-term goal is to track and increase that local farm procurement. And so here's an example of that tracking. So this is the example for the Bay Area Hospital and School Group. Every 6 months, and we'll be moving now to a quarterly system, we report on the local procurement impact of the school and hospital purchasing. And this webinar has actually given me the idea of also including the amount of organic procurement related to their family farm local purchases and their overall organic procurement, which we can also see in these usage reports. And for some of our hospitals, they prefer organic produce to the tune of probably half or more of their produce if they're on the higher budget side. On the lower budget side, at least with these monthly or holiday-based local promotions, they're much more often able to access organic produce. For this particular group, over a 2-year period with 7 institutions, they increased their family farm local purchasing, and that means the farms that were identified with signage in their cafeterias, by $188,000. And that was with the work of Healthcare Without Harm and the Community Alliance with Family Farmers trying to make that information available. The local local produce purchasing overall, so that's within the state, was for that group was 48%, making the overall impact of state bought produce in California for that group almost $3 million, so $2.8 million over 2 years. And then over time, our goal is individually and as a group to set goals and continue to increase those numbers. And then these are a couple of examples. One really great strategy that we've found that I would encourage any farmers to seek out if they have the capacity and interest to connect more with institutions is to bring the food service directors to the farm. The food service, we found not only does anecdotally it make a lot of sense and people really enjoy, especially during their slower seasons, which are very limited in institutional food services, but in their slower seasons, getting out and really getting to visit the farm. So this photo on the left is Christine Koch at Koch Farm in Watsonville that packs and ships for a little over 40 farmers in the Watsonville area to a national market, and is also organic certified and a pioneer in the organic movement in California. And this was a farm tour this summer that we brought out a group of schools and hospitals with the goal of not only trying to increase potentially bringing on Koch Farm as a vendor as they have distribution capacity, but also increasing the Koch Farm purchasing through those distributors for those schools and hospitals. And aside from the anecdotal evidence, there's also a great deal of proof in our tracking that the farms that are visited by the food service directors are the farms that actually get the purchasing when we track for it later on. So in this last example I gave you, the vast majority of purchasing was with a group of farms that took place that the food service directors had toured a year and a half before. And on the right is an example of a promotional day. So while there are many challenges for food service directors, almost anyone is willing to put in that extra effort and really try to take the leap when it's around a promotional day. So we often promote Food Day and Earth Day, which are commonly celebrated across institutions. There's also talk of doing a summer solstice event this year with the Bay Area Leadership Group. But this is an example of a special map that we send out with a grower profile illustrating an apple grower that's selling to a school for this food day directly. But we also do these for groups of produce items that are selling to hospitals that look just like this farm. I mean this signage. And then so starting to wrap up in how to connect to hospitals with CAFF, reach out to me to learn about opportunities to connect with vendors who are selling to hospitals. Furthermore, as we continue working with Healthcare Without Harm this year and continue developing our projects to understand community growers being able to sell to hospitals, we're also trying to reach hospitals that are trying to bring on more food hubs or grower-identified smaller scale distributors. But we're also very happy to be working with these larger scale distributors to develop practices that are really friendly to local farmers for schools and hospitals, and seeing that organic certified is so popular. Contact distributor partners that you're already working with, that you're already selling to understand whether they're marketing organic and local produce to hospitals. Many times they might have hospital and school clients. They make up a small portion of many different distributors' businesses. But by reaching out and expressing that you're interested in having your produce featured in those schools and hospitals can be really meaningful to those distributor staff and be an additional demand from the supply side to connect with your consumers and see if you can add marketing value for them to make that connection to their guests and students. And then to reach out to us if you are seeking to gain third-party GAP certification and want support in planning. We're planning a series of workshops around the state this winter and also do direct support for farms that are developing food safety plans in order to prepare for third-party certification. And that's something we just gained funding again for the next 2 years. And then finally, contact your local hospital food service director. If demand from your farm comes from them to their distributor, or if you're able to be a direct vendor for them, it's a really great way to build that relationship, create opportunities for farm tours, and see if you can, and actually the last example of the McClendon's farm really plays well into that relationship that developed into the farm on the hospital property. So reaching out to a food service director that's one of the decision makers is a great way to start as well. And then here is our contact info and mine in case anyone is interested in reaching out. I'm sure that the conference organizers will also be following up with that information.
All right, thank you so much, Ben. That's awesome. We have a couple questions specifically for you, and then we'll open it back up to general questions for any of our presenters. So specifically for you, Ben, based off the purchasing goals of the institutions that you spoke about, if California farmers were to convert to organic production specifically, are they likely to have more business with institutional purchasing than if they remain conventional?
I think that the prevalence of, I think yes, but I think that's very much in parallel with that being the case in any retail market. I think that actually I would say we're even later in onsetting in the institutional settings. You have groups like the University of California and groups like Healthcare Without Harm and Kaiser on large scales, creating these system-wide goals around sustainability, and more importantly, creating hard-line reporting requirements with tracking that include if a produce item is organic. And that is a rapidly growing movement nationally. I started working in this in higher ed in New York, and it's literally the same standards and the same community that's doing it here, but really leveraging millions and millions of dollars. The food service industry for institutions is a multi-billion-dollar industry in the United States, and organic is one of the most accessible items that has reached an economy of scale and a competitive price point that is accessible to hospitals and schools. So I think organic certification, with that by deduction, is a very smart move to leverage market access for local farms.
Thanks for that, Ben. We had another question come in for Bob. It sounds like Chef Caputo is an awesome chef. What was his background and why is he so passionate about organic food specifically?
Well, he is CIA trained in New York Culinary Institute of America, and he had worked in several different roles, a lot of them in the country club setting, very wealthy clients, and of course the type of food that he was preparing there and how he had to satisfy them gave him some special assets regarding his training experience and ability to prepare some really great food. And he has, from the time he, I think, got out of school, he was passionate about his ingredients. And he's always been, in every role that I have talked to him about in the past, he's always been passionate about using local and organic. And that's something that a lot of chefs are not. And we have, you know, we have 80 some odd restaurants that we cater to, and those, all of our chefs are, it's really important to them, but there's probably in this valley 3,000 or 4,000 more that don't really care. They just want to buy the cheapest they can buy. So it's just something that was built into him and supported certainly by the hospital.
Got it. Beautiful. Kathleen, someone asked you that you mentioned that Kaiser Permanente is also looking for processed products, but it sounds like a lot of what you're sourcing right now are fresh ingredients, at least from the farmers markets. What's the best way for organic processors or handlers who don't sell at farmers markets or through produce distributors to get their products into hospital food systems?
Specifically into our system or into others?
Sure, you can speak to your system.
Okay, yeah, I mean, for our system, we work, well, in Northern California, we work with Daylight Foods, which is our primary produce distributor. And so that for produce, that's the primary way to get it, I would say, to get it into our Northern California food system. And I know that Daylight has been, you know, working with us for many years, and you know, they are constantly looking for new options for local and sustainable products and organic products to get into our patient meals in Northern California. For our cafeterias in Northern California, Morrison is one of our big vendors because our cafeterias are contracted out, and so I believe they may work with some different vendors like San Francisco Specialty. In Southern California, we primarily work with Sunrise Produce, and they are an excellent partner in terms of getting the products into our Southern California facilities. And again, they're all aware of our 100% sustainable goal, and so they are in the process right now of looking for ways to meet that goal. So I would say the time is ripe to reach out to those distributors in terms of getting into Kaiser Permanente system.
Got it. And then a follow-up question to the 100% sustainable goal. You gave a list of what Kaiser considers sustainable before 2025. Is there any room for changing the stipulations, perhaps in favor of organic?
I would say that, you know, I mean, we're well aware of the benefits of moving to organic, and I mean, that's when I think about the criteria that we have. I mean, that's definitely, I would say the ideal would be to have products that are both local and organic, and you know, especially with the items like the Dirty Dozen, you know, like focusing on those as a first priority. You know, it's definitely a high priority of ours. However, I think that the big challenge, one of the biggest challenges with the organic is the price point. So if there's a way that we can, and this speaks to also some of the efforts with CAFF and with, you know, collaborating with other hospitals and schools, is how can we leverage our volume, and then also how can we determine what we need and start making commitments up front with growers so that we can so there'll be a stronger relationship on both sides to kind of guarantee that flow of products from organic farms into Kaiser Permanente and to other hospitals and schools.
Got it. Bob, one final question. Oh, you have another? Yes, please weigh in.
I just wanted to weigh in on two things that come to mind as well. Is that organic is also antibiotic-free when you're dealing with any animal products, and so to leverage that messaging as well. And the antibiotic-free movement has exploded in the last couple of years, from doctors greatly curving their prescription of antibiotics to patients to a broad national, broadliner level shift from Tyson and Purdue down to the local level of producers away from using antibiotics as a subtherapeutic antibiotics for animal proteins. And organic was the front runner in that movement. And so just to continue to market organic as antibiotic free as well, I think is valuable. And also on the note of reaching economies of scale and being more accessible in terms of price, what we're starting to see is farmers being willing domestically to, with their local retail relationships, to forward contract and grow out extra land that they don't have a customer for, that might be beyond what they were expecting to grow, but are interested in growing if it's easy, and forward contracting that, growing out to what the hospital or school's needs are, even through their existing distributor. And it can be anything from an MOU to a formal contract to a handshake we've seen. But to look at that on more of a short-term local level and not just look at contracts as a major national or international way of doing business to get those price points.
This is Kathleen. I would like to build on what Ben said and just say that, organizations like CAFF are really invaluable to us as institutions because of all of the reasons he mentioned around the bandwidth and the time and the resources, ours, which are limited, to make these connections and help to set up these systems to get the food from the growers into Kaiser or into other institutions. So, I mean, it's just, they provide such a valuable service, I think, to both the growers and to the institutions to fill this huge need to address the issues around the distribution, availability, and making those connections. So thank you, Ben and Kath.
You are so welcome. And the county departments of agriculture are also great resources there.
Just a couple final quick questions before we wrap things up here at 11:30. So Kathleen, what actions is Kaiser actively taking to preserve the integrity of organically sourced foods prepped through hospital kitchens to patient tables?
Well, the items that we do source that are organic, we at this time we have not, for the produce, we are not always able to label every single item as it comes in. We have, we make efforts to put on our menu, that we're sourcing organic, local, and sustainable foods, but it's sometimes challenging just to, I think it depends on the setting. Like in our hospitals in Southern California, in our cafeterias, it's a little bit easier because the products come in directly to the hospital. They're able to label things within the cafeterias, and on the patient meals, it's a smaller scale and easier to manage. I would also say that in our Northern California cafeterias as well, there are the ones that are contracted out to various vendors, they are also able to label the products as they, are put into the cafeteria, like on the salad bars or in other foods that are produced. So there is some ability there to keep that traceability for which items are organic and which are not. And we really work hard to try to market that and make sure that the patients and the cafeteria patrons know, because it's added value, I think, for everyone, both for the grower who's providing it and also for the producer. Additionally, our our produce distributors provide us with information about the growers so that we can try to maintain that throughout the supply chain. It can be challenging, most challenging I would say in Northern California with all of the facilities that we serve. But we try to, if we're offering an organic item, we try to offer it across all of the facilities in Northern California so that we can be consistent in how we can market it.
Beautiful. Well, we had a couple other questions, but we're going to have to leave it there, folks. Thank you so much for everybody who chimed in and made this a really excellent conversation. And I wanted to give a special thank you to all of our presenters. We're really grateful that you're taking the time to share your thoughts and your experiences. And it'll help all of us, I think, help move the ball forward as far as getting organic and locally sourced sustainable products into hospitals. So thank you so much. There's lots of thank yous coming in off the line. I wanted to, put the pitch out there. If anybody's interested in organic certification, feel free to contact CCOF. Please check out CCOF's educational pages for upcoming trainings. There's a webinar on organic importing and exporting on November 17th, and we're doing a San Francisco wholesale market tour, which is an in-person tour, December 8th, with a focus on vendors that work with certified organic producers. And I just wanted to say thank you again for all of you for taking time out of your busy schedules to pop in and do some extended learning here with us today. And as soon as you exit, there'll be a survey that pops up. Please take time to fill out the evaluation survey. It really helps us do our jobs a little bit better. So thank you again for your time, and hope you guys have a beautiful rest of your day.